Hello everyone. Assalamu alaikum. I am Dr. Hina Siddiqui. So we are going to discuss today Anchorage in orthodontics. By the end of this lecture, students will be able to understand the concept of Anchorage requirement in orthodontics. So let's see a picture. Here what you all see. Yes, there's a tug of war going on. So the concept of Anchorage is very similar to the game of tug of war. In this picture, as it is shown that there are two groups pulling each other with rope. Because of this, there will be action forces as well as reactionary forces. For every action, there is an equal and opposite reaction. In orthodontics, we need to maximize the tooth movement which is desired, minimizing the undesirable side effects, that is, undesirable tooth movement. So, anchorage is the resistance to unwanted or undesirable movement of teeth. Anchorage can be classified in many ways. For example, according to the number of anchorage units, it can be classified as simple, compound, or reinforced. According to the number of jaws involved, it can be classified as inter and intramaxillary. It can also be classified according to the site where the anchorage units are located. So it can be intraoral and extraoral. Further, we can classify anchorage as stationary, reciprocal, and reinforced. So now we will be discussing different types of anchorage. In simple anchorage, active movement of one tooth against several anchored teeth is seen. In compound anchorage, the lesser resistance teeth are moved against greater resistance teeth and the number of teeth are also greater here. Intermaxillary anchorage. As the name indicates, the two jaws are involved here. One jaw is providing anchorage to the other jaw. For example, we can use elastics. This can also be called as Baker's anchorage. Here in picture, it shows class 2 elastics are used to correct molar and canine relationship. Reciprocal anchorage. When the anchorage units have the same distribution of forces in the periodontal area, that is, the teeth to be moved have equal root surface area. For example, in this picture shows two teeth are ligated by the wire. They both will be receiving equal and opposite forces, and as a result, the space between them will be closed. Here is another example of diastema closure, where similar situation is happening. This picture is showing increased value of different teeth. So according to this picture here is showing the anchorage value of different teeth. So can you all tell me which of the following teeth can have the highest anchorage value? As the force is distributed along the median area, that is the root surface area, the teeth which has the greater amount of root surface area will be providing greater anchorage as compared to the single rooted teeth. Coming to the reinforced anchorage, as the name indicates, reinforcement means to add any other unit into the anchorage segment. So here we can add a second molar or bend a second molar to enhance the anchorage. There are several structures which can provide anchorage extraorally. For example, cervical region and the occipital region for headgears, forehead and chin for the face mask. But we have a biggest disadvantage of using these extraoral appliances because the patient cooperation is not under our control. Here in the picture, it shows a face mask is given to protect the maxilla. What is stationary anchorage? When one group of teeth are moved in bodily manner, whereas the other group of teeth shows tipping movement. This would be termed as stationary anchorage. But in this case, the treatment can be done in two phases. Once the incisors are tipped lingually, then root uprightening has to be done. Now we will classify anchorage according to the requirement of space. This was given by Raymond Pegg. Number 1 is maximum anchorage, which is also called type A anchorage. There is a 75 to 25% ratio, where 75% of the extraction space has to be closed by backward movement or distal movement of the anterior teeth, and only 25% of anchorage loss can be allowed. In moderate type of anchorage, that is type B anchorage, there is a 50-50 requirement of space for anterior and posterior segments. In minimum anchorage cases, that is type C anchorage, the anchorage requirement is so minimal we don't need to reinforce it by adding any other teeth, but we need to bring the posterior segment more forward. Here are few pictures. You have to name the anchorage employed here.